Hello again, you're watching the Midday View on eNCA. Now, the Western Cape has seen a spike in mental illness in their health facilities in the wake of the coronavirus pandemic. The mental health care system was already under immense pressure before COVID-19, and the pandemic has not made things any easier. Let's discuss this now with Saadiq Kariem from the Western Cape's Health Department of Health. Mr. Kariem, good afternoon. Thank you very much for your time. How bad are things? I mean, we tend to focus on mental health issues in October because it is Mental Health Care Awareness Month. So how bad is the situation in the Western Cape today?
Sure. So I think we had a look at our data, and what we did was we compared the period April to September 2021 with the same period April to September 2020. And we looked at the mental health admissions to our acute general hospitals. And in fact, what we found was a staggering 40.6% increase in the mental health admissions at our acute general hospitals. And we dug a little bit deeper into that data. We also looked at the emergency admissions. So these are admissions that came into our emergency centers and our acute hospitals between the period June to October 2021. And we in fact found that 30% of those admissions were related to some sort of psychosis, and a staggering 22% was in fact related to substance abuse and behavioral disorders. So I mean, it does give one a sense of the staggering explosion, if I can call it that, of mental health admissions during this time period.
And any of these that you've noticed in your data particular are sort of alarming in your view?
Absolutely. I think the issue of substance abuse is particularly alarming. We know that during COVID, there have been periods of lockdown. We know that, poverty is almost pervasive in South African society. And in fact, from data from the NIDS-CRAM study from some of our colleagues have shown that that has in fact worsened. So hunger had worsened during this COVID pandemic because of lockdowns and people not being able to obviously enjoy the fruits of their labor. So the hunger had worsened. In a sense, poverty would have worsened, economic hardships would have worsened, and then just simply the fear and the isolation that people have experienced during lockdowns. A lot of this obviously then translates into and expresses itself into these mental health admissions, and in particular, substance abuse.
Now, the healthcare system was already under immense pressure ahead of COVID-19 in terms of mental health facilities. What are the new challenges, therefore, that you are now faced with in trying to deal with the surge?
Very difficult, yes. I mean, the mental health has always been under pressure even prior to COVID. And as those numbers show, you know, the 40.6% increase. What we hope to be doing, in fact, is one of the biggest bottlenecks in our system is at our acute general hospitals, or what we call district hospitals, where, in fact, we want going to be allocating additional resources to improve the flow of patients from these hospitals to the psychiatric hospitals, where they can obviously receive more definitive care. But in addition to that, we also do need and will be focusing on vulnerable groups such as children, adolescents, and psychogeriatrics, because these groups have suffered perhaps more than other groups. And so we'll also be allocating additional resources over the coming months to ensure that we improve the mental health care and well-being of these vulnerable groups.
Yeah, the drug substance abuse, as you said, is up. I think the particular ways of dealing with it, but the psychosis and the other stuff sometimes can be stigmatized, and people then don't even seek help. What's the message from the Western Cape Department of Health about normalizing mental care issues?
Absolutely, and this is exceptionally important because we do find that in society, mental health is, people who suffer from mental illness are stigmatized in our societies. Our advice to people is please do come and seek care at any of our public facilities, and we will redirect people who need more definitive care from these facilities. We also have counselors available. We want to obviously improve access to communities at our primary care facilities and primary care clinics, where most people, 90% of people, would in fact be presenting. So during this month, October, Mental Health Awareness Month, we really want to encourage people to take full advantage of this. And if they have any concern, to call, so they can call our helplines, but please do present at our primary healthcare facility.
Okay, thank you very much for your time. Saadiq Kariem from the Western Cape Department of Health.